Hello, everyone. My name is Lynn Richardson, and I'm here with my colleague, Dr. Cardinale Smith, to talk about a very important topic. You know, there's a growing need to help patients and families with end-of-life decisions, and I know this is one of your areas of specialty. What role do healthcare providers play in helping patients and families cope with end-of-life decisions?
Yeah, I would say healthcare providers really are the leaders in doing that. When patients are facing life-limiting illness and dealing with end-of-life decisions, as providers, our primary procedure, regardless of our specialty, is really communication. And being able to talk about what that means in the setting of someone's goals, values, and preferences for the kinds of treatments they would or would not receive, and in the context of what is medically helpful, is critically important because, most patients and families don't understand. We see shows like ER as an emergency room physician, you know all about that. And they think that just like on the shows, someone who comes in can be brought back to life, right? And that's unfortunately not the reality for many people. And so I think really being able to walk patients through what expectations are given their disease and the disease trajectory is critically important.
Have you found any trends or changes in the way physicians who are not oncologists approach this issue with their patients?
Yeah, I think there is a growing understanding that this has become even more important. We talk a lot about what's called advanced care planning, which is really sort of talking about and discussing and documenting the care that you would receive if you were critically ill and not able to do this. And I think what we're seeing is among other specialties, people are engaging in this more. And people are wanting to learn how to do it more, which is important.
Well, I think it's very important. As an emergency physician, sometimes I see patients with life-limiting illness, and now they've had a complication or a decompensation, and they're in the emergency department, and important choices have to be made about what do they want, what should we do, how aggressive should we be. And sometimes there's been no conversation about goals of care with these patients and these families. So what is Mount Sinai doing to help patients and families prepare for these kinds of decisions?
Yeah. So at Mount Sinai, we have the #1 Department of Geriatrics and Palliative Medicine in the country, and so we're proud of that. And palliative medicine, palliative care, for those who may not be as familiar, is specialized medical care that really focuses on providing care for patients with serious illness. And it can be anywhere throughout the trajectory of illness, but really focuses on relief of suffering and focusing on managing symptoms, pain, shortness of breath, whatever it may be related to your illness, and also supporting their loved ones through the illness, because that's also a critically important part of this. And so at Mount Sinai, we lead a lot of communication skills training workshops for our clinicians. We also have specialty palliative care clinicians who are available to consult for patients to really have some of those more difficult conversations, to manage those more difficult symptoms, and to help sort of bridge the care between the primary specialty physician and the patient and their families so that goals and values are aligned.
And it's really important that people understand this isn't giving up, and that palliative care is really something that happens along with curative therapies, and it so improves the experience of the patients, their quality of life, and the burden on the families and the caregivers.
You're absolutely right. In fact, many studies have shown, and work that we've done ourselves has demonstrated that palliative care concurrently alongside life prolonging treatment, even for patients who may be living with life limiting illnesses, not only improves quality of life, decreases depression, but also prolongs survival. And we've seen that over and over and over again. In fact, many society guidelines like oncology incorporates that into this standard management and says that all patients with advanced illness should also be able to receive specialized palliative care.
So is there anything else you think people should know about this issue?
Yeah, I think what I would say is that it's just critically important that if you are someone who's living with a life-limiting illness, approaching the end of life, that you have conversations with your loved ones, that you engage your primary care clinicians in these conversations, because what's critically important is that we provide the care for you that you want for yourself, and to have those conversations early and to have them often.
Thank you, Dr. Cardinale Smith. I'm Dr. Lynn Richardson. Thank you for joining us.